Hello and welcome to a deeper dive with me, Dara. Cam and Max is completely silent today. We have a special guest today, former Florida Surgeon General Scott Rivkees. He is a pediatric endocrinologist who is now, hang on, it's a mouthful, the Associate Director of the Accelerated Master of Public Health Program, the Vice Chair of Health Services Policy and Practice, and Professor of the Practice of Health Services at Brown University. Dr. Rivkees led the state at the onset of the COVID pandemic and for a couple of years after that. Please join us and listen to what Dr. Scott Rivkees has to say about the state of public health and the delivery of public health services in Florida and around the country.
You're listening to A Deeper Dive with Dara, a podcast by City and State, Florida.
Thanks for joining us. We've got a really super duper guest, special guest today. Former Florida Surgeon General, Dr. Scott Rivkees. He's now Professor of Practice at Brown University School of Public Health. Welcome, Dr. Rivkees. We were just discussing physicians, the legislation dealing with medical conscience. I wanted to ask you, what brought you to Florida? What led you to take the job as Florida Surgeon General, as a longtime pediatrician? You took the job before the COVID pandemic. You were on the job when this historic event took place. What made you decide you wanted to be the state's top doctor?
Yes, thanks so much for that question, Dara. So first of all, I'm a pediatric endocrinologist, and
you can relate to my diabetes woes. Sorry, didn't mean to interrupt.
Absolutely, and we take care of individuals who have different types of inherited conditions. One of which is congenital hypothyroidism, where children are born without a working thyroid. And this is the most common preventable form of severe intellectual impairment. About 1 in 3,000 children are born with this. And so screening for congenital hypothyroidism is a public health measure that actually is a bedrock of pediatric endocrinology. And then also, when I was practicing in Indiana for a while, I noticed that the treatment of some children with congenital hypothyroidism could be optimized. I started the Indiana Congenital Hypothyroidism Follow-Up Program. When I moved to Connecticut, I became part of the state's Genetic Advisory Committee. So I always have been interested in public health issues. And when I had the honor and privilege of being the department chairman at the University of Florida, physician in chief of Shands Children's Hospital, we took advantage of the great programs that the state has to keep children safe. Public health measures, programs for children with medically complex conditions, early step programs, child protection team programs. So much of general pediatrics involves public health.
Right.
And I was approached to interview for the position, and instead of taking care of children, one patient at a time, a family at a time, larger group of individual, this was a special opportunity to influence the health of millions.
Are you glad you did it?
It was one of the most incredible things I have done in my lifetime. I'm grateful for the opportunity. And I think in many areas, we made a big difference.
What sparked this series of op-eds you've been doing for about the past year now, criticizing the way mostly Republican-led states have been approaching healthcare and restricting giving doctors more leeway and restricting businesses and communities from adopting public health measures they think will protect their communities.
Yeah, first of all, I'm a physician. I'm also in public health. The two are very much linked with one goal in mind: keeping individuals safe and keeping all of us in our community safe. So that is something that is very important. And faced with this giant sea that we have of misinformation, false information, I think it's important for individuals who have grassroots experience, knowledge of what the facts are, to continue to advocate what are the measures, what are the policies, what are things we all need to do, what are the messages out there to keep all of us safe and healthy.
Are you worried about retaliation?
No, because I'm speaking medically substantiated, public health substantiated facts. What I'm worried about is that we're in such a polarized climate now that we've eroded the trust in the expert. Gets kind of the questions you were asking earlier. Who do you listen to?
Right.
That's what I worry about. When we hear, a pediatrician who's cared for a child their entire lifetime, whose parents say, no, the vaccines you're giving my child aren't going to help that child. That's what makes me worried. Things may go to extreme situations where standard therapies, things which help children, adults, older people, younger individuals, may be refused, which can lead to potential harm.
Yeah, I think in one of your, yeah, I was concerned while while I was in line getting a shot, a vaccine, because I was one of the early ones because of my medical condition. I got early access, and I've had all my boosters. I'm, okay, haters, you can send hate mail, whatever, but I'm convinced that it helped me to stay safe. Um, I was I have been wondering for a while, and I don't know if there's any research out there yet that this anti-vax movement is specifically targeted towards the COVID vaccinations, if that has led to a decrease in vaccinations for school children for MMR, for example. Are you aware of what the research shows on that? I mean, for goodness sake, if anyone who's traveled outside the country, I mean, there's certain vaccinations that countries require you to take in order to gain entry to the country. So it's not like vaccines are, as you pointed out, historically, they have been used to save lives. So I'm just wondering if there's any research showing yet whether this opposition to COVID vaccines has led to a decline in school children's vaccinations levels.
So first of all, a really important point. The anti-vaccine movement and their influence actually started before the pandemic. In many parts of the country, uh, there was this wrong notion that the measles vaccine was associated with autism.
Right.
There's no evidence of that association. And we started seeing rates of vaccination beginning to decrease, and also very strong organized anti-vaccine movement. And during the pandemic, when the pandemic started, there was a lot of information about vaccines aren't safe, these vaccines aren't effective, particularly starting going into the first half of the year 2021. We had vaccines first appear December of 2020. And we actually have seen that actually spread. So, there are reports that have been published in different scientific journals that actually show that routine pediatric vaccination for many vaccines has actually decreased, and in some parts of the country, speaking about the measles vaccine, for
Right.
example, there aren't enough children who have been vaccinated within a community to slow the spread of measles. And we actually have seen some examples of this. Just over the past 6 months, we've seen outbreaks of measles occurring in several communities in which children have either been unvaccinated or under vaccinated. So this is real.
Yeah, and I mean, and these diseases like measles, they can cause lifelong complications, if not death, and can quickly spread in a community, right?
Yeah, measles is one of the most contagious viruses that there is, more contagious than COVID. Measles can cause severe pneumonia. Measles can cause neurologic problems. Measles can cause long-term hearing loss. I believe of the children who recently got measles in that outbreak that happened in Ohio, almost half of them had to be hospitalized.
Yeah.
It's not a trivial virus.
We were talking about the medical conscience bill. What rights do patients have when it comes to doctors' positions? I think that this bill says that doctors have to disclose somehow to patients. But I guess my question is, what's your advice to patients when you're looking for a new doctor? I've had the same doctor I've had for 20 years. She knows me, I know her, she knows what I do. We talk about politics, so I know where she stands on the issues. But what's your advice to patients when they're seeking out a doctor? And then I want to talk about, as a pediatric endocrinologist, this crusade against treatment for transgender children. But first, what's your best advice for patients seeking care?
First, we need to recognize the landscape that we are in. We aren't training enough medical professionals, whether they're physicians, physician's assistants, nurse practitioner, nurses, mental health workers, psychologists. There's a huge national shortage. So if you call up to get an appointment with a new provider, you know, it's very rare that they will say, come in tomorrow or come in today. People often have to wait months. So healthcare is local. And so if you're trying to find somebody, speak to your neighbors, your friends, your local relatives, find somebody that they feel comfortable with. Because again, it's an incredibly sacred relationship between you and your physician or your family member's physician. So it's somebody you have to feel comfortable with. You're entrusting us with your well-being, so you have to feel comfortable in that regard. So a lot of it really has to do word of mouth with it. Then the other thing too is we're in situations where individuals may have insurance plans that will specify certain physician networks. So you can look on the portals to get the names for physicians that you might be able to potentially see as well.
I'm glad you brought up insurance because I wanted to ask you what role you think that health insurance has in the provision of medical care nowadays.
Medical care is expensive. And
Yeah. I
yeah,
think I told you I fractured my tibia. I have very good insurance. I got a bill for the ambulance. Okay, so for people who don't know, your tibia is your shin bone. It was broken right below my knee, so I was completely incapacitated. I needed help to even get into a chair from laying on the floor. My copayment for my ambulance trip alone was about $800. So even if you do have health insurance, healthcare can be very expensive. Your copayments can add up. So just a little ambulance note to listeners: ambulance transportation is not covered by insurance in Florida. Uh, Maybe they can do something about that. But anyway, back to
I
health
mean,
insurance is expensive.
yeah, I mean, spot on. So healthcare is about 20% of the gross domestic product.
Wow.
Trillions of dollars a year. And where does that get paid for? Either by insurance plans, which are either federal, state, or private insurance, or the individual. So if an individual, has older than 65, they will qualify, for Medicare, a program that was put in place, signed into law by Franklin Roosevelt. And then we have Medicaid, in which it's shared funding by the state and the federal government. This will cover, many children, and also will cover adults. Then you have private insurance, and then you have individuals who don't have health care insurance. And so, if somebody does not have health care insurance, uh, look in terms of what's available in the local state and area to be able to get insurance. There are actually a number of portals which are out there as part of the Affordable Care Act as to where you can get health insurance. The state of Florida, the portals Kids Care as to where you can sign to get health insurance for your children as well. So again, uh, lots of insurance plans out there. Check with your state, your local resources to see if you can sign up for insurance if you don't have it.
Sure, somebody with a chronic illness, of course, insurance has always been, health insurance has always been important to me. A lot of young people don't think, they think they're immortal and they never need it. You mentioned Medicaid. Florida is one of the states that has chosen not to expand Medicaid. I believe, I don't know the number. I'm sorry, I don't have it in front of me, but hundreds of thousands of people lost their coverage. It was expanded through the Affordable Care Act, and then that fell off earlier this year. Do you think that that Florida should have expanded its Medicaid program?
Yeah. So first of all, uh, in Florida before the pandemic, the vast majority of children in the state could get insurance through state Medicaid. Something for us to really be proud of. For adults, though, about 18% of adults in the state were uninsured. And as to whether a state has Medicaid expansion or not, that's a political decision that is made
Got it.
that is made by the state.
Okay, fair enough. You're a pediatric endocrinologist. There has been a lot of talk lately about transgender care, gender affirming care for transgender children and adults. Florida is among the states that has banned gender affirming care such as puberty blockers, hormone therapy, and surgery. Surgery, I have to say, is very rare for children, for people under 18. So let's just focus on puberty blockers and hormone treatment. That is against the law now in Florida, made some significant changes to the provision of care for transgender adults. What say you about those efforts by states to ban doctors from providing that care?
First of all, let's talk a little bit about transgender care and how intricate, deliberate this process is. It's not something where a child goes in and says, I want to have gender conversion.
You
Conversion.
don't waltz in and say,
No,
I think I'm a boy, give me some
right.
drugs.
So there, are months and months and months, if not years, of therapy that happens beforehand. So individuals who are interested in gender affirming care, gender conversion, this is something that has been discussed and vetted by teams that typically involve psychologists, psychiatrists, pediatric endocrinologists, and most of all, the patient and their family. It's not a decision which is taken lightly. Second, in terms of the treatment which is done, they typically will be puberty blockers, particularly if somebody who's female or somebody who's male wants to transition to be female. And the reason for this is because once you start having puberty, testosterone, that will give, certain physical changes. And these drugs which are given basically turn off the pituitary gland so that an individual wouldn't be producing testosterone. Surgery, I'm not aware of surgery which is being performed or has been performed in Florida, for individuals with this. So the notion that these children are being operated on, this is a false notion. And as far as these medications, in the event somebody changes their mind, these medications are reversible. We use these medications in the treatment of other medical conditions, such if a child develops puberty early on. So let's suppose you have a girl that starts developing puberty when she's 5 or 6 years old. She may be on these medications until she's 13. So these medications have lots of experience. They have an excellent safety profile as well. So that has to do with the notion of, the psychological and medical aspects of transgender care. So some of the things, and there have been studies done looking at long-term outcomes, and overwhelmingly, individuals who've gone through gender-affirming care overwhelmingly are glad that they did what they did. And there may be a small percentage of individuals who wish they didn't, and that can be addressed. So, our feeling for the field of pediatric endocrinology, I would say the field of medicine in general, that these are delicate medical matters. These are very highly personal decisions, and that delicate matters, personal decisions, are best addressed by the family, the patient, the child, and the physician having a conversation about collectively what is best for this individual.
We will be right back with Dr. Scott Rivkees, professor of practice at Brown University School of Public Health, former Florida Surgeon General. We've got a lot more to dig into.
Here at Deeper Dive, we want to hear from you, the listeners. We invite you to send your questions, comments, and feedback to our mailbag. You can reach us at deeperdive@cityandstatefl.com. That's deeperdive@cityandstatefl.com. Get your 2 cents in by sending us an email.
Welcome back to A Deeper Dive with Dara. And with the politicization of medical care, it's similar to what we discussed with the issue of vaccinations. This is a very, as you say, and from my reporting on this, complex medical and psychological, psychiatric issue. How do parents, the state is presenting research that they have sought from people who are active in the anti-gender affirming care community to combat standards of care developed by other experts. I mean, what do parents do? Again, I think I know what you're going to say. Again, it comes down to trust, right?
Well, it's trust in law. So, law's been passed in the state of Florida.
That's true.
And, how does one, how is the issue being addressed for individuals, as you're saying, who aren't in favor of this, not just in favor, in opposition. And there was a recent legal ruling in Florida uh, by a judge in favor of individuals who wanted to have gender affirming care. And this is typically where the evidence ends up getting heard. And so the courts will end up deciding this in many different areas. I will tell you what is happening nationally, and that is individuals who want gender affirming care that is prohibited in their states with either penalties to physicians, in some situations, penalties to the parents.
Child abuse.
Uh, yeah, those individuals are moving out of state.
Right.
Uh, I'm also aware of situations where parents have given up custody in Florida of their children to relatives in other states where this is allowed.
That's a frightening scenario, to think that you need to relinquish custody of your children to do what you think and your doctor thinks is what's proscribed for their physical and mental health. I wanted to go back. Thank you so much for joining us, Dr. Rivkees. I wanted to go back to your column on succubus and incubus, because you also talked about, and you and I discussed this in our recent conversation, about indoctrination and schools, and what schools are doing to limit information that's available. You know, the Governor DeSantis, you're not going to refer to him by name, but I will, because he's behind these efforts, and the legislature is in agreement. I like to say in agreement. That's a shout out to one of my Southern friends. In agreement with him on this issue. Their critics call it book banning, states calling it parental rights, but information that kids can access, books and other materials that kids can access in schools. That was the premise of your succubus and incubus column. I'd like you to, could you expound on that a little bit for me today?
Yeah. Uh, so, in terms of the title, it was your doctor can talk to you about succubus, but your teacher can't talk to you about Toni Morrison.
Right.
A Nobel Prize, Pulitzer Prize winning author whose books I read in high school that are now banned in some areas. So let's put things back in perspective. So, coming out of this pandemic, actually even going into this pandemic, we knew that the mental health of students was not good. And it certainly has worsened during this pandemic. There are data on this subject. The CDC collects information from what's called the Youth Risk Behavior Survey. And what this shows, the data for 2021 were just recently released. They show tremendous increases in feelings of student hopelessness, poor mental health. In fact, if you look at that report, it says 22% of high school students have seriously considered attempting suicide. So, what it tells us that we're in special times, where children really need help. And we need to take conflict out of their lives. And we see, shortages of teachers, massive shortages of teachers in Florida and through the rest of the United States. I have personal friends, great teachers who have left their profession. So, we lose experienced teachers, we lose their connections to children. This is going to have an impact. So, my feeling is that rather creating a contentious environment that makes it more conflict for the students, we should actually turn the temperature down, take the children out of the spotlight, have the children feel that they're being supported, feel that their teachers are being supported. We hear stories about how a teacher shows Michelangelo's statue of David,
Right.
A Disney movie, all kinds of examples you know, so, they see what's going on. People think that students are reacting to this and they don't feel community stress. Well, I think that they do. The other thing we need to really realize is how the students get information today. Far fewer students read than before. In fact, I remember seeing a piece from a Florida newspaper where they were talking about the books that were being banned, that they pulled the library cards, and one of the books had been taken out 3 years ago and never returned, and the other ones were never taken out. Students spend hours a day on social media.
Right.
In fact, the U.S. Surgeon General issued an advisory about social media and the impact that it can have upon children. He did not issue an advisory about don't let your children read books.
Right.
It's very, very, it's also incredible in terms of trying to control information flow to students, how difficult it is. There was a recent study which came out that showed almost 15 to 20% of children less than 10 years of age have watched pornography.
Wow.
So to think that, we're going to influence how a child thinks or how a child can be indoctrinated by pulling a book off a shelf in the library, um, there's not a lot of support for that. In educational experts, and what this is doing is creating a situation that again adds to the conflicted world that children are now living in.
A very divisive atmosphere and a lot of anger we're seeing at school board meetings. Superintendents are leaving, school board members are being, that now we have politicized school board races. They will now be partisan. So education seems to be sort of the tip of the spear for the culture wars.
I think the question we have to ask ourselves, what's the best thing for do to help our kids? We know our kids are under stress right now. The data are very clear about what is going on.
Well, you say the data very clear. I want to interrupt you. I don't want to interrupt you, but I just wanted to add something that I think you pointed out in one of your recent pieces is that Florida has dropped out of the CDC. I think I'm going to get the name wrong and you'll correct me, but like child risk assessment survey, behavioral risk assessment survey. Am I even in the ballpark?
Yeah, it's the Youth Risk Behavior Survey,
Okay.
and I encourage people go to the CDC website, pull it up, and look at the reports, and they will show year over year trends for things in terms of what are the things they look for: sexual activity, smoking, vaping,
Drug use.
violence, drug use, feeling threatened, things that really provide important information for those of us in public health, those of us in the educational sector, to know what is happening to our kids and how can we help our kids.
Yeah, Florida is developing its own survey, and I will say that based on a recent report I saw, I think there's just a handful of questions addressing a critical issue. Oh, I see Dr. Rivkees. You guys can't see him, but he's reaching for some paperwork, so maybe he's going to talk about that Florida's survey now.
I'm not talking about survey. These are the national data, and this is
Okay,
why it's
yeah.
important. This is all tied in with the child's well-being and the child's in a child's health. I mean, these surveys have questions about different types of activity, sexual activity, drinking activity, drug use activity, and I tell you, when you look at these things that happen, people should really look at these surveys to really understand what is happening to children. I mean, one of the things in terms of the mental health issues, experience persistent feelings of sadness or hopelessness. 42% of
Wow.
the high school students, so attempted suicide, up to 10%. So, we need to address pediatric issues. We always start with data. And this sort of helps us understand what are the issues that we need to be able to focus on. And this is why this survey is so important. Now, there are other states that have surveys that can also be very involved as well and provide useful information. So the CDC survey isn't the only way to get this type of information. The important fact is that we get this information so we understand what is happening to our kids, so we know how to help our
It
kids.
also participation in it, and it also allows us to compare ourselves to other states, right? I mean,
Exactly.
thank you again. I wanted to ask just sort of some 30,000-foot questions as we wrap up. I really appreciate your time, Dr. Rivkees. In the aftermath of COVID, what are the three biggest changes to the practice of medicine that you've seen?
Yeah, that's a great question. So first, we've seen delayed health care. Individuals have not gone to their doctor's office because they're afraid to go out. So not only have we seen the deadly impact of the virus, we've actually seen excess mortality for other medical conditions because people have delayed health care. I'd say the second is the loss of confidence in the medical expert. If you can't trust your doctor to give you information about health practices, what uh, uh, vaccines or not, what are you going to do when you get cancer? Who are you going to listen to uh, for that? And then I would say the third thing which is coming out is legislation which is coming out across different parts of the country that are going to put handcuffs on public health. Public health plays the role in helping to keep the public safe. And if we take away the ability of public health to recommend mitigation measures, the ability of public health to isolate individuals with certain types of medical conditions, the ability of public health to advocate for basic core public health measures such as vaccination, we are all going to be much more vulnerable in the future, whether there's a pandemic or not.
Maybe maybe you just answered my final question, and that is, what are your top concerns about the practice of medicine right now?
We have to restore trust in medicine. A patient needs to know that when they are sick, that they, their parent, their child is going to get medical care, and that the advice that they get is something that they can follow, and that the advice in the standards of care stand on pillars of accurate and true fact based information. So we need to get back to where we were, where we can trust our doctors and scientific experts.
Dr. Scott Rivkees, former Surgeon General of Florida, now Professor of Practice at Brown University School of Public Medicine. Thank you so much for your time. I'm going to keep reading your op-eds, and I hope that you'll join us again.
Yeah, thank you so much, Dara. This was a really important conversation, and thank you for bringing attention to it.
A Deeper Dive with Dara is a podcast by City and State Florida, hosted by Dara Cam, produced by Ryan Daly, and music for the podcast was recorded by Periodic Labs LLC and performed by Ryan Daly and Danny Reyes.